Children teaching children. It's the same all over the world. From a very early age, children look after each other, and they can do this very well. Building on this, an approach to health education for children was developed by the Child-to-Child Trust. The concept was devised in England in 1979 as an initiative for the International Year of the Child. Since then, it's spread to over 70 countries, including here in Delhi, India. The Oral Health Self-Care Project is based on the child-to-child principle of children teaching children. Here, they're checking each other for signs of gum disease. Because it's seldom life-threatening, it has received little attention until recently, and yet it's a condition which affects more than 80% of children in some areas. A school monitor now instructs his classmates in a technique which shows the presence of dental plaque. They apply a vegetable dye to each other's teeth and are told that bacteria shows up a darker colour. In this way they learn that teeth that look clean before aren't necessarily. Now it's time for careful brushing. Some children use a datum made from the twig of a neem tree. They're being reacquainted with the traditional practice that was once widespread throughout India, and it's certainly as effective as a modern toothbrush. In recent years, use of the datum has declined due to urbanization, but here its value is emphasized. If they have worked hard with their brushing, no dental plaque should remain. Close examination should reveal not a trace of green. Now they know that a datum really works. But where do you find a neem tree in an urban area? Not always easily. Here they learn what one looks like and how to make their own toothbrushes. This is important because not all families can afford to buy the commercially made variety. The lesson here is that dental hygiene needn't be expensive. Not only that, the children learn they can make a contribution to their family's health. Aptly enough, the name of this program in Hindi is Smiling Teeth. Dr V B Mathur, who initiated it, sees great merit in the child-to-child approach.
It has been a tradition in these families that the older children have looked after the younger children. What is new about the child-to-child probably is the recognition of this very fact. The child-to-child has recognized these facts and usefully, truthfully and effectively utilized them in the process of health education.
Although the program started by Dr. Mathur focused on preventative health care, it is set firmly in the context of overall health and development. Here, a class monitor is asking other students to choose their favourite food. They learn that having a sweet tooth can lead to dental decay. To avoid this, they're introduced to other lower sugar alternatives. In the process, they also learn the basics of healthy eating for healthy bodies. Children learn fast, and lessons learned are most likely to become lifelong habits. Having understood the elements of good nutrition, they're now shown one of its results. A well-fed young body should increase proportionately in height and weight. The emphasis here is on health, not disease. For every child wants to grow up big and strong, and some do. One of the aims of the child-to-child approach is to empower children and increase their sense of self-esteem. The more they learn about their own bodies and the choices they can make, the more likely this is to happen. Learning to take each other's pulse, both before and after physical activity, shows them how to monitor their bodies and pay attention to health matters. Lessons learned in the classroom are practiced in the community. Drawings on posters become food choices for families. Children are very effective healthcare messengers and agents for change. It's the ripple effect that children have as they go about their business that encourages Dr. Sheila Veer. child-to-child coordinator in India.
The child-to-child projects, in fact, I should say child-to-community projects in India have demonstrated that children are very receptive to information, new information, and are very enthusiastic to play a responsible role in the community and contribute to the development of the country.
In April 1991, the London-based Child-to-Child Trust received UNICEF's prestigious Maurice Pate Award for extraordinary and exemplary leadership in and contribution to the survival, protection and development of children worldwide. What ultimately Child-to-Child was recognized for was the introduction of the revolutionary idea that children can help not only each other, but the community to lead a better, healthier life. The children here are planting their own little neem tree. In the process, they learn to care for and foster new life. What we learn is the value of children teaching children, and from small beginnings, what great tasks these little hands can accomplish.